Post-operative instructions, bone grafting. Diet. A soft, mild, and nutritionally balanced diet should be consumed for 2 to 4 days, or longer if necessary, after your surgery. As the tissue around the bone graft heals, you can return to your normal eating routine. Swelling and bruising. Keeping the head elevated with 2 pillows when lying down can minimize facial swelling. Swelling and bruising can be minimized by applying cold compresses to your face. 30 minutes on, 30 minutes off for the first 48 hours. After 48 hours, warm compresses will help reduce the swelling. These should be continued 30 minutes on, 30 minutes off until the swelling has subsided. Rinsing. No vigorous rinsing or spitting for 3 to 5 days. After the first day, you may softly brush the adjacent tooth surfaces as long as the brush does not disturb the graft site. Avoid applying pressure with your tongue or fingers to the grafted area. Do not lift or pull the lip to look at the sutures. Denture or flipper. On the day of your surgery, you will be given specific instructions regarding when you should wear your denture or flipper. Wear your denture or flipper as instructed by your doctor and see the text on the page below for possible options. If any sores or swelling develop around or under your denture, leave them out of your mouth and call the office. If you cannot place your dentures back in your mouth, leave them out and call the office. Bleeding. If you experience heavy bleeding, try repositioning fresh pads so that pressure is directly on the surgical area and your remaining teeth are kept apart slightly by the pad. Pain. Some form of pain reliever should be taken before the numbness goes away. Over-the-counter medications like ibuprofen, Advil or Motrin, acetaminophen, Tylenol, or aspirin are adequate if there are no allergies, have been tolerated in the past, and do not interfere with any other medications. For more involved procedures, a prescribed narcotic can be taken. The narcotic can also be alternated or taken in addition to ibuprofen if there are no allergies and has been tolerated in the past. Taking your medications with food will decrease the chance of nausea. Remember, narcotic pain medications will impair your judgment and reflexes, so driving and operating heavy machinery is to be avoided. Antibiotics. You may be prescribed antibiotics to prevent infections. If so, take all of the medication as directed. If you experience any adverse reactions, such as nausea, rash, or itching, discontinue the medication. A rash or itching may indicate an allergic reaction to a medication. Antihistamines, Benadryl, will usually counteract the hives, rash, and itching. Swelling of the lips or tongue, or difficulty breathing may represent a more severe allergic reaction, and you should seek medical attention immediately. Infection. Although antibiotics may be prescribed to prevent an infection, a wound infection may occur a day or several days after surgery. If you experience a sudden increase in swelling, throbbing pain, or a foul-tasting drainage and suspect infection, call the office as soon as possible. Smoking and alcohol. Tobacco and alcohol should be eliminated during the first 2 weeks after surgery.